Wonderful. So thanks y'all for coming back. We're after our last break. My name is Glenn Stern. I'm an assistant professor of criminal justice here at our Abington campus, just north of Philadelphia. I also serve as the co-leader of the Consortium for Substance Use and Addictions, the Stigma Reduction Collaborative at Penn State. And most of my work is at the intersection of criminal justice and public health, specifically with issues associated with substance and specifically substance use and stigma. And so we're really excited to be able to talk to you today with a really wonderful panel. One of the things that you've likely picked up on is that there's been a word that has been discussed throughout each of these individual panels across the entire consortium's meeting today, and we're really excited to be able to talk to you specifically about how to address that word, and that word is stigma. These discriminating perspectives and behaviors towards people who use substances have been shown to have deleterious effects on people who are seeking treatment, who are working through their recovery process, as well as the people who surround and support those with substance use issues. So we really think that this is an important issue to be able to discuss with you today. And so we have a great panel compiled of folks from really great organizations. First, we have Jordan Lewis from the Department of Drug and Alcohol Programs. We have Jennifer Murphy from Penn State Berks, an associate professor of criminal justice there. And Joe Pyle, the president of the Scattergood Foundation. I'll let them introduce themselves, but well, let's start with Jordan Lewis first.
Good afternoon, everyone. Thanks, Glenn. It's really great to be part of this panel. My name is Jordan Lewis, and I'm the policy director for the Pennsylvania Department of Drug and Alcohol Programs, which I'll call DDAP. And I'm also a Penn State College of Medicine alum myself. So in my role, I work closely with Secretary Jennifer Smith, as well as Governor Wolf's policy office to develop and implement a policy agenda as it relates to issues surrounding substance use. So the reason that I'm on the panel today is that DDAP is proud to be part of a statewide stigma reduction campaign called Life Unites Us, which launched back in September 2020. For this campaign, we've been partnering with the Penn State Harrisburg Pollock Center, the Public Good Projects, which is a public health nonprofit that specializes in behavior change interventions, and Shatterproof, which is a nonprofit dedicated to addressing stigma and supporting quality addiction treatment. So you can access the campaign on its website at lifeunitesus.com, but briefly to explain, there are three main arms to the campaign. So the first is content that's shared on social media and the Life Unites Us website that reaches the general public. So anyone who follows the campaign on Facebook, Twitter, Instagram, or YouTube will see video testimonials of individuals and their loved ones, as well as information and facts about substance use disorder, treatment, and recovery. The second arm is more targeted outreach and paid media. So the campaign has engaged social media influencers, which are individuals with a large social media following, who are sharing messages about the importance of addressing stigma toward SUD, and in some cases sharing their own stories too. So paid media is also reaching individuals who may not typically see this content otherwise. Maybe they're not following Life Unites Us, or they probably aren't even thinking about SUD in their everyday lives already. So if you're on social media yourself, you've probably seen paid content for pages that you don't typically follow, but it pops up anyway on your feed. So that's going on here a little bit too. And then the third arm is engaging Pennsylvania communities in a variety of ways to understand attitudes and needs of the populations they serve. So Life Unites Us is unique in that it uses a collective impact approach, which means that groups across Pennsylvania have given us their commitment to fighting stigma through various collaborations. So we currently have 100 committed partners across the Commonwealth, and this engagement helps shape the content and the direction of this campaign going forward. It also allows us to build rapport and provide resources to these groups to address stigma in their own communities. Part of this strategy also involves bi-monthly webinars, which anybody can join, as well as in-depth interviews with specific community groups. So as I mentioned, the Life Unites Us campaign launched back in September 2020. So it's about a year and a half old. To date, the campaign has had about 5.5 million impressions. And as part of the data collection, Penn State has been conducting baseline and follow-up surveys to representative samples of Pennsylvania to corroborate that indeed people are seeing the content online and remembering it. So at the 1-year mark, our follow-up survey indicated that it had reached almost 1 in 3 Pennsylvanians, and compared to those who had not been exposed to Life Unites Us content over the past year, those who had were significantly more likely to live with and continue a relationship with someone struggling with opioid use disorder, provide naloxone to friends and families, and they agreed that buprenorphine was an effective treatment for OUD, among other findings. So we're very proud of this campaign and happy to share additional details later on in the panel. Thanks for having me.
Wonderful. Thank you, Jordan, so much for giving us the overview and introducing yourself. Next up, let's have Jennifer Murphy discuss her work.
Hi, everyone. Thanks, Glenn. Like Glenn said, I'm an associate professor of criminal justice at Berks, and I have been working on some stigma reduction. A couple of years ago, a colleague of mine, psychology professor, also here at Berks, we received a grant from DDAP to implement stigma reduction training. We were targeting criminal justice. Can you hear me okay?
You're cutting it in and out for me, Jen.
Okay. How about if I get closer? Can you hear me now, or am I still cutting?
It keeps coming. It keeps coming and going, even when you're close.
So I should.
Jen, why don't we have Joe introduce himself first, and then we'll come back to you. How's that sound? Joe, why don't you introduce yourself? Thanks so much.
Good afternoon, everybody. My name is Joe Pyle. I'm the president of the Thomas Scattergood Behavioral Health Foundation. And our work is centered around 3 main areas. The first is around advocacy. The second is around technical assistance. And then the third area would be our general grant support. And if we look across those 3 areas of work, in the advocacy and thought leadership, we have a series of papers that have been published by national experts that get to the underlying issues of stigma, and also look at harm reduction, which I hope we will spend some time today talking about the implications of harm reduction. Also, the foundation has been involved in doing pre and post testing with organizations around their stigma reduction programs. I think it's important to look at pre and post testing in programs to know, are they having the impact in stigma reduction that they want? The other area in our general grant making, what we've really been is a huge supporter of harm reduction. We've been a funder of the Safe House Project in Philadelphia. We've worked hard to get folks to recognize the benefit of harm reduction. We've been the funder of fentanyl strips so that folks can use those as part of a harm reduction strategy. We've also been very supportive of targeted expansion of evidence-based programs, both in the criminal justice system and in emergency rooms. And I'm thrilled to be on the panel here and look forward to the discussion. Thanks, Glenn.
Wonderful. Thank you so much, Joe. And then let's try Jennifer one more time.
How is it now? Am I still in and out? A lot better. Okay, so maybe just that reset, right? Who knows? So I guess I'll start from the beginning. My name is Jennifer Murphy. I'm an associate professor and chair of the criminal justice program at Penn State Berks. I've been doing several different stigma reduction work over the past couple of years. About 2 years ago, a colleague of mine and I, Brenda Russell, she's psychology professor here at Berks, we received a grant from DDAP to do stigma reduction trainings on campus. We started with faculty and staff, and then we also did some with students. We targeted students in majors that we thought they were likely to engage with people with substance use disorder at some point in their future careers. So we targeted criminal justice majors, psychology, and rehabilitation human services. That's a major at Penn State that's similar to like a social work case manager kinds of professions that students would go on to. So we did on-campus stigma reduction workshops, and then COVID hit. So we moved our stigma reduction trainings to an online format, to a video that we created, and that is ongoing. So we are keeping that available to students every semester. We've also increased campus representation. So we extended our outreach to other campuses, Altoona and Hershey, to have students there as well to look at the video and complete our evaluation around the efficacy of those trainings. I am currently a community fellow for the Consortium on Substance Use and Addiction, and that project, which we are at the very beginning stages of, is to develop stigma reduction trainings for police officers, and we're going to pilot that in Berks County and try to demonstrate the effectiveness of those trainings for police officers in an attempt to ultimately institutionalize stigma reduction training, either in the academy or through continuing education credits for police officers. So those are the projects that I'm currently working on, and I am also a co-leader of the Stigma Reduction Collaborative with Glenn.
Well, Jen is very busy. It's really great to have all of you here. You know, my first question for the panel is actually for Joe, but others can feel free to chime in here. Joe, you know what, you started to touch a little bit on this, and so if you could just expand on, you know, why is it important for us to really be thinking about stigma? Specifically, you know, how can addressing stigma positively impact patients with substance use issues?
Sure, Glenn. I think it's really important as we talk about stigma to first really understand what is it. And I think what we have to understand is that when we're talking about stigma reduction, we're talking about changing stereotypes, prejudice, and discrimination that is being addressed to those with substance use disorders. And I think why that's important is because when we are in a stigmatized environment, it develops fear. It causes people to not want to seek treatment out because of the fear that is generated by that. Also, there's an awful lot of authoritarianism as it relates to substance use disorders, where we feel like we have to take responsibility for people, that we have to give them direction, that they're not capable of making their own decisions. We treat them like children. And I think that with those kind of stigmas, we know that that will limit care. And I think that when stereotypes are at their highest, what it does is it really withholds help from individuals, and it causes social avoidance, and it really leads to segregation in treatment. And I think that one of the things that we would hope for is that we could really think about integration in care. And I think it's also important when we're talking about stigma, you know, we use terms like mental health, substance use disorders, and behavioral health sometimes interchangeably, but stigma can vary tremendously across the use of those. An individual can have very low stigma as it relates, stigmatizing behaviors as it relates to mental health, but when you ask them about a substance use disorder, they may have very high stigma. So I think it's important that when we're trying to increase access to services, that we're thoughtful about how stigma impacts people's willingness to enter into treatment. I'd be curious to hear Jordan and Jennifer's additions.
I agree with everything you just said, Joe. Nothing to add there.
Well, I guess just the one other thing that I would throw out is that it really is a shame that we've politicized harm reduction. And I think when we look at the Commonwealth, and I'll be curious to have hear the comments from Josh Shapiro later. But I think we live in a political climate that's taken fact-based harm reduction strategies and politicized them. And I think that makes it hard for people who are seeking treatment to get past the barrier of stigma.
Thanks, Jude. Jen, anything to add there?
Yeah, I think that's absolutely true. And one of the things towards the end of what Joe was saying also about stigma and how stigma can work differently in different realms. In general, research shows that there is more stigma toward people with substance use disorder than people with other mental health issues. So, and as we know, there are a lot of co-occurring disorders as well. So it really does magnify the stigma towards substance use. And I think what Joe was getting at, there's the stigma towards substance use disorder, but there's also just a stigma toward any drug use. And the discussion around harm reduction and how that all plays out. But that these stigmas pile up on issues of substance use and addiction in a way that is detrimental for people.
Yeah, I mean, Jen, you talked a little bit about the research, and so I think it's important for us to understand a little bit of the research around stigma reduction, right? So can you tell us a little bit about what that is telling us? What's working?
Sure. So like Joe mentioned as well, there's different kinds of stigma. A lot of the stigma reduction work, and I think Jordan will talk more about that as well with the Life Unites Us campaign, is aimed at reducing what we call social stigma or public stigma. So those larger messages in society about people with substance use disorder. So an attempt to change those kinds of stereotypes and to make people more empathetic to issues of substance use disorder. So in that research realm, one of the things that is promoted as having a positive effect is changing language. So how we talk about addiction is extremely important and really influences how then people think we should deal with addiction and substance use disorder problems. So language is critical for reducing stigma. And in general, we're in agreement that person first language is always better. So saying a person has a substance use disorder, a person with substance use disorder, rather than saying an addict or an alcoholic, junkie. I mean, some of these we know would be problematic, but using that person first language is really important, so that we're humanizing people with substance use disorder. We're not talking about them as a thing. Other stigmatizing language that we are trying to get rid of, use of clean and dirty when talking about urine drug screens. So trying to get rid of that moralizing language as well when we're talking about it. Talking about medications, using medications as part of treatment, not as substitution, right? Opioid substitution therapy was a term that was used for a while. So changing language is really important. The other work that the research shows is effective in educating people about addiction is talking about the impact of treatment and how treatment helps people. So there's some interesting things in the research about just education alone. And when we talk about addiction as a disease, it can actually have an unintended consequence of increasing stigma. So people get the idea, well, if it's a disease, if it's a chronic disease, like we use these analogies, diabetes, heart disease. If it's a chronic disease, then there must be no cure. So, it just increases stigma in a way that is unintended. But if in those education sessions, we talk more about treatment and the positive effects of treatment, it is shown to reduce stigma. And that's one of the reasons when we did the stigma reduction workshops on campus, we had people in recovery talk about their experiences. We had someone who had developed an opioid use disorder when he was in college talk about his experiences. And we had a woman who had a long journey through substance use, and talked about how she had been revived with naloxone at least 8 different times, you know, and talking about trying to get at those also the stigma against naloxone use, and why it's necessary, and the necessary part of our strategy for dealing with the opioid crisis. And even when we had the educational sessions about addiction, we tried to emphasize the treatment aspect as well. So not just talking about it as a disease, but the physician who talked about, you know, the more medical aspects of addiction gave, you know, some really good information about how medications for opioid use disorder work in the brain, you know, and how, and why they're effective. So that was a key part of our strategy as well, and that was based on the research, and that just that exposure, that humanizing people with substance use disorder is shown to have an important, you know, reduction effect for stigma. So keeping, you know, the human aspect of things, and reminding people that, you know, these are people, and that they can be us, they can be our family members, they can be our friends. These are messages that seem to resonate with people.
Excellent, thanks, Jennifer. Joe, Jordan, anything that you want to add there? Well, Jordan, you know, I'm kind of curious. So how's the Commonwealth using knowledge and research to inform its work on addressing stigma in our communities?
Yeah, so I gave a pretty broad overview of how Life Unites Us works in my introduction, but I'll just take this opportunity to dive into a couple specifics around how some of our research findings are informing work in specific communities. So as I had mentioned, part of our collective impact approach includes in-depth interviews. So far, we've conducted interviews with CBOs, which are community-based organizations. We've done a round with friends and family of individuals with opioid use disorder, and we'll soon be engaging our single county authorities, which are the county level drug and alcohol authorities. And these interviews have really helped inform the overall campaign in a couple different ways. So one message that's really come out is the importance of anti-stigma messaging specifically. So kind of what Jennifer just touched on. You know, that includes things like advocating for addiction as a public health crisis and not a moral failing. It includes normalizing medication for opioid use disorder, and promoting non-stigmatizing person-first language. From those interviews, we've also gleaned just how much sharing stories can help reduce stigma for friends and family members of individuals with SUD as well. They're in the thick of it with their loved one too, and they also need that support and encouragement to seek help, whatever that might look like for them. We're also addressing stigma more locally in this campaign in 3 ways. So one is through a community building workbook, which is currently in development with a lot of feedback coming from our community impact committee. That will be something that will be available for local groups to work through on their own. That will include resources, and it'll really be informed by what groups are experiencing on the ground, so to speak. Second, we're conducting currently a pilot study in healthcare workers at 2 hospitals, testing 2 different stigma training modules. So that just recently launched, and we're looking forward to seeing how that evolves and being able to offer some best practice recommendations down the road to addressing stigma in the healthcare setting. And lastly, we just recently closed applications for the Community Award Grant Program, which will provide nonprofit Pennsylvania CBOs funding to develop and implement outreach activities that decrease stigma in their local communities. So we're looking forward to announcing the awardees of that and see the work get started on that very soon. So lots of good community level work already in motion, and lots more to go here soon.
Excellent, thanks, Jordan. You know, one of the things that we've been dancing around is this concept of evidence, right? And so when we think about the potential impact for hosting a campaign or developing these initiatives with regards to reducing stigma. It's important that we not only think about potential impacts, but also reducing some of the unintended negative consequences, as Jennifer, you talked a little bit about before. And so I think it's important for the audience to really understand the concept of what evidence-based practice is. And so can you tell us a little bit about that and why that's important for us to consider when thinking about stigma reduction initiatives? Go ahead, Jennifer.
Sure, I can start. So like I said earlier, there are some things that are pretty strongly demonstrated by the research. And like
Jen, your microphone is having the same issue again.
How about now? Is it still okay? All right, well, we'll try. Is it okay?
It's coming back in and out again.
Sorry. How about now? Is it okay? Okay. Well,
we can hear you. Yeah, let's try it.
Okay, just cut me off. Just give me the, so like I was saying earlier about some of the specific strategies that have shown to be pretty effective across research, but the research is evolving at the same time, because a lot of the research on stigma reduction, it relies on reduction in stigma toward mental health and HIV status. And so now those of us doing stigma reduction work kind of looked at that and trying to apply it in these other settings towards substance use disorder or drug use in general. And so I think part of the research is evolving to see what does translate effectively and what maybe doesn't. And part of the early research was also problematic, not a lot of sound methodology with control groups and randomization. And one of the things that we see now, which is great with all of this stigma reduction work going on, but I'm starting to think about how are we isolating what are the effects of these different methods? Because, I'm doing something in Berks County. Our SCA does a ton of anti-stigma work, right? There are billboards, there are radio ads, and then I'm trying to do something, and there's other kinds of campaigns that are coming in and might be statewide. So I think it's sometimes a little difficult to tease out where is the impact and how well do each of these methods work. I think there needs to be more research on self-stigma and what is going on, like how are people experiencing these changes if they see them. I just finished a couple of focus groups for a project I'm working on with Glenn, where we're looking at stigmatizing language used in websites of substance use disorder treatment programs. And so we conducted some focus groups of people who had been in treatment recently to talk about different kinds of stigma that they experience. And the positive thing from those groups is that everyone has seen stigma reduction. So people talk about, 10, 20 years, they've seen this really positive change in society, but they still all experience stigma, right? So, but I think having more studies on self-stigma and how people who use substances experience stigma and what their perception of any changes is important for moving forward. I think we need more of that research.
That's great, Jen. Any comments there from Jordan or Joe before we move on?
Just, I think I appreciate Jennifer's comment on the role of self-stigma plays. And I think, having a greater understanding and conversations around that, I think is critical. So I appreciate that work. So thank you, Jennifer.
Also, to echo what Jennifer and Joe mentioned, we do, as part of our survey, we do assess whether individuals had a past history with substance use disorder, or if they're willing to admit any current substance use. I don't have any of the results of that handy to share right now, but that is something we are assessing as part of the attitude survey that we are doing at baseline and the various follow-ups. So happy to pull some of that data and see what that's looking like for the group.
Thanks, Jordan. So Joe, you talked a little bit about some of the barriers that you're seeing specifically in our communities when we think about issues of stigma. So what do you consider to be some of the largest barriers to dismantling stigma, overcoming it, and how might we move that needle? How might we overcome those issues of stigma?
Sure. Well, I think that, Jennifer was speaking to the fact that, we're doing research and there's not been a lot of research done. And I think that, our track record on stigma reduction has probably not been great. I mean, if you think back to the war on drugs and Just Say No and DARE, that, those programs, I think, have gone a long way to creating stigma. So the idea of what works in the area of stigma reduction, I think the new research, and I hope the work that both Jordan and Jennifer and you are doing, will kind of change that. So, I think that a couple of things become really important. And I think one is, what role does the media play here? We talking about language matters. I think it was Jennifer, it might've been Jordan who said, language does matter. And when you think about media outlets, and how they use stigmatizing language when they're reporting the evening news. I'm not one to be on a lot of social media, but what are the influencers saying about addiction and substance use disorders? So I think we've got to do better. We've got to hold media more accountable. I think educational strategies have been proven to work, but it's not one and done. We have to repeat it over again. And I think that's important as we think about educating kids. Having one speaker isn't going to change what they might be learning in their home or their neighborhood around stigma. And I think that Jennifer's comment earlier about maybe the most powerful tool is that of a contact strategy. Patrick Corrigan has done a lot of tremendous research on the success we can have with contact strategies. And I think when we have contact strategies, it's important to show people like us. It's one thing to, highlight somebody famous who's beat an addiction, a substance use disorder, but it's another to show somebody that's like me that's done that, because it may be too aspirational for us to see ourselves beating a substance use disorder with a celebrity as our role model there. So I think we just have a lot of work to do on more advocacy, more on the facts, and really highlighting what works in the way of contact strategies. So our barriers may be time and development of more best practices.
That's great. Thanks, Joe. Well,
can I just add something to that, Glenn, if I'm not cutting out? Joe brought up some really great points about contact strategies and how effective it is to have people who look like you. And I think that also raises the issue of the intersection of stigma with race and class, and that it is some stigma reduction is shown to work better when there are white people being the ones featured, right? So stigma goes down, but if it's someone of a lower SES, of another race, sometimes the stigma reduction is not as impactful, right? There was, I don't remember the author of the study off the top of my head, but there was one where they were trying to feature a woman who was a mother who had an opioid use disorder. And when they showed her as an upper class white woman, the audience was very sympathetic, and there was shown a reduction in stigma. But when they showed her as a poorer woman of color, that people were not as empathetic. So there are these, maybe going back to what Joe was saying earlier, these kind of stigmas that pile on top of one another in different ways and really kind of tearing them down and considering that these multiple stigmas has to be part of the strategy.
Yeah, that's fantastic. Thanks, Jen. Jordan, we've talked a little bit about some of the policies and some of the issues around stigma reduction, some of the barriers, some of the needs. And so when we think about some potential for changing some of the systemic stigma, some of the policies, the rules, the regulations around getting people into the treatment mechanisms that they need in order to be successful. So what policies does the Department of Drug and Alcohol Programs recommend shifting to ensure more inclusivity towards those with substance use issues? And how can we really work to reduce some of those systemic stigma issues within our systems at the governmental level, all the way down to the community level?
A big question, Glenn, but that's a great question. And there are two main pieces I want to touch on specifically as it relates to the Life Unites Us campaign, and then a more kind of general response to that question. One thing I didn't mention earlier is that the campaign is supported by state opioid response funding from SAMHSA. So if anyone is familiar with this funding stream, you know that it's very opioid focused. And the first year of the campaign was funded by that first round of SOAR funding. So as SOAR has continued, SAMHSA has begun allowing stimulants and addressing stimulant use as an allowable expenditure. So now as we're halfway into year 2, you're going to start seeing more stimulant messaging, poly-use messaging, just broader substance use disorder stigma messaging. If you check out the campaign on social media now, you see that we've introduced this over the past few weeks, and you'll start seeing more and more video testimonials that aren't so opioid focused. So that helps a lot. First of all, funding stream. Second, one way we've really been keeping tabs on how inclusive and representative the campaign remains is through our Community Impact Committee, which I mentioned very briefly earlier. The committee is actually the result of some very early concern that we were hearing before the campaign really took off, which was that the public video testimonials might be exploiting individuals in recovery. So the committee that we have is comprised of individuals with lived experience and or those who work in the field, and has really been dedicated to ensuring that the campaign methodology is ethical and that the content shared in the campaign is using inclusive language, and that all the materials will be accessible to all Pennsylvanians in some form. So I'd say one major recommendation that we've garnered for anyone who wants to do inclusive anti-stigma messaging is to have a group like this to give that honest feedback, because it's been really invaluable for our campaign. Overall, in terms of policy change, we're still learning a lot as this campaign unfolds, and it's clear that we have a lot to chip away at before we really see those big systemic barriers erode. We are encouraged to see that the campaign is having a positive effect on attitudes based on our survey results so far. So, clicking that share button on social media is a very easy way that you can start spreading those anti-stigma messages today. We are continually developing resources that are informed by everything we're learning, and hope that, all of this stigma reduction work that's taking place in PA and really across the country now will have an impact on where we are this time next year or 5 or 10 years down the road in terms of just changing the conversations.
Thanks for that, Jordan. We got a question in the question and answer portion, and it came up after Joe, your comment around specifically harm reduction, and so I'm gonna take that question now because it relates to these policies. And so the attendee asks, do you think it's possible to advocate for policy without causing more politicization or of harm reduction, and presumably potentially more stigma? And what does that kind of advocacy look like, and what people are along that pathway? Joe, do you want to talk a little bit about that intersection between stigma, policy, and harm reduction? You mentioned it earlier.
I think that's a great question. And I think, my answer would be, even though we live in a very politicized world right now around these issues, I think we have to be fearless in moving them forward. I think that if we bow to the pressure and climate of fact-based conversation, I think we put our Pennsylvanians at risk. So I think that we need to do more than just tip our toe into the water. I think we need to move ahead with facts, and we need to present those facts fairly and reasonably. But I think if we don't do that, we will not see any progress in the reduction of stigma. And more important even than the reduction of stigma is we won't see enhancement in people's lives that are suffering from substance use disorders.
Thanks, Joe. Any other comments from others?
Yeah, I'll just add that as far as harm reduction being politicized, and it absolutely is, at the same time, I do see it becoming more accepted in a wider community, more politically conservative legislators. And I think part of it is because how hard rural areas have been hit by the opioid crisis in particular, but now stimulant use as well. So I think there's that common ground when, when areas, rural parts in opioid overdose deaths, for instance, the legislators there, am I in and out again? Sorry. The legislators, at least in rural areas, I see are starting to be, some are becoming a little bit more open to certain harm reduction strategies and legalizing things like fentanyl test strips and syringe exchange programs.
Thanks for that, Jen. By the way, you came back at the end, so you're fine.
I was talking about rural. Did you get that part of it? All right, there we go.
Thanks. My last question for you all is, what can Penn State do to help to really address stigma towards substance use? Why don't we start with Joe this time?
Okay, well, I think there's a lot that the university can do, I'll start one. I think that, and not being on campuses, on the Penn State campuses, I can't speak to the level that currently exists, but what I would say is, one is the university normalizing substance use and mental health screenings on campus. Is it making those screenings readily acceptable? Are we training staff, faculty, and students on the issues? Could we be using a program like mental health first aid for the whole Penn State system, or maybe there's a different one? I think what becomes really important in universities, are we providing services on campus? Is the counseling center have enough capacity to serve the need on campus? Are we supporting organizations like Active Mind and JED to have real presence? Because I think what we know is that I'm probably the oldest one on the Zoom here, that young people are having open and honest conversations about mental health and substance use disorders, and we need to constantly give them the facts that they can use in those conversations. I think one thing that we see very little of is recovery-oriented housing. Can we have housing on campus that's welcoming to folks that are in recovery? I think then on an individual level, we have to be informed voters. I think to Jennifer's comment about maybe the change that's happening in rural Pennsylvania related to some of these issues, but I think we have to be informed. I think we have to support harm reduction strategies wherever we can, I think it's important not to otherize people in this conversation that way. And I guess just there's one thing that I really believe at the university level, because I had this experience talking to a provost at an Ivy League school, when there was a real reluctance to build out mental health and substance use programs at the university. And I said that if the president of the university walked out of College Hall and said, by Friday, we want to raise $50 million for care on the campus by Friday, I think she could raise $100 million. And the provost said that absolutely would happen, but that's not a priority of the university. So I think this has to become a priority. The mind and the body are connected. And I think universities have an obligation to be thoughtful about both. So maybe that's my kind of message for this.
Thanks a million for that, Joe. That's great. Jordan, why don't you take the next comment? What can we do?
Yeah, I think Joe had some great thoughts there. You know, we know Penn State has over 20 campuses all across the Commonwealth, and that's a huge opportunity to start those anti-stigma messages as early as a student's first year if they haven't, you know, been exposed to them in high school or earlier. I graduated from undergrad more than 10 years ago, and I don't remember hearing anything about addressing substance use except to go to the health center if you think you have a problem. I really think the conversation is moving in a positive direction, and I think it's moving pretty quickly here in the last couple years, but there's still a ton of opportunity and lots of great work going on that's inching us closer to where we need to be.
Thanks, Jordan. And then Jennifer, what can we do? You're part of Penn State. What can we do together?
Well, first of all, Penn State can fix the mic on my computer. So yeah, I think Joe and Jordan made some great points. Also, you know, the Stigma Reduction Collaborative, our working group here for the CSUA, has done a great job of going across all Penn State, you know, and bringing faculty and staff and graduate students together who are interested in this topic, want to do more on this topic. And I would also say Glenn has done a terrific job of reaching out to folks at other institutions, because sometimes we become siloed in just our university and what we're doing. But, you know, we have connected with people from Howard University doing stigma reduction work, University of Missouri, other places, so that there can be more collaboration, because there is a lot of work going on, and we don't want to all just be reinventing the wheel. I think Penn State, as you know, as an institution, could possibly also help reduce stigma at the federal level. It's kind of mixed messages that the National Institute on Drug Abuse puts out flyers about stigmatizing language when drug abuse is in their name. You know, in 2007, then Senator Joe Biden introduced legislation to change the name of NIDA to something like the National Institute on the Diseases of Addiction. But I don't even think it went out of committee. The bill went nowhere. So 15 years later, we still have SAMHSA, substance abuse, right? And IAAA. We still have stigmatizing terms in the federal institutions that are designated to handle these issues and provide research funding for these. So there's a lot of mixed messaging going on there. And I think maybe Penn State could have a role in trying to change that as well.
Fantastic. Thanks, Jen. We have a few minutes left for a couple of questions. So feel free to put them in the chat. Haven't seen any more. We did have one participant mentioned, Joe. They said that it was your comments have been totally on point, so you're doing great. But you know, Jen, you talked about this concept of reaching out to others, that we're not the only ones here at Penn State addressing issues of stigma within substance use issues. And so I think it's really apparent that folks from the government level, so you know, Jordan, your work within the administration, Joe, all the way to not-for-profit and community-based organizations, that we have a real need to make sure that we're thinking beyond just higher education, right? There are lots of organizations, entities, community members that are really thinking critically about how do we help people recognize that substance use is not a moral failing, that substance use is